Good morning, ladies and gentlemen. My name is Natasa Todorovic, and it is my pleasure to greet you on behalf of the Red Cross of Serbia. For more than 2 decades now, I have focusing on matters of aging, older age, and older person to support evidence collection and advocacy. One of the important topics in my work is elder abuse and violence against older person. This is a global dangerous phenomenon that still remains very under-recognized and under-researched. Therefore, I am also a regional representative for Europe for the International Network of Prevention of Elder Abuse. World Health Organization data on the global prevalence of elder abuse shows that 1 in 6 persons over the age of 60 experienced some form of abuse in community settings during the past year. In care institutions, 2 out of 3 employees report that they have committed abuse in the past year. Of course, these numbers are just the tip of the iceberg, and it is far to suspect that elder abuse rates are much higher. It is estimated that only 1 in 24 incidents of elder abuse are reported to an institution. Why is it important to talk about elder abuse? First, demographic aging is a global phenomenon, and we have more and more older persons in need of support. Also, elder abuse is often not recognized by professional or even older person and therefore often invisible in the society. Violence against older person is a violation of their human rights and public health issue. It has been insufficiently researched, and it is clear that more research is needed so we can efficiently respond to it and prevent it. I wear several hats in my job, and over the past several years, one of the focal point of my research is approach to violence and abuse from life course perspective. If we speak of prevention, my latest study focusing on elder women in southeastern and eastern Europe was very important. Not only the study shows that 56% of older women have experienced some form of abuse and violence since age 15, and that 16.7 have had this experience in the last 12 months, but it also highlights that the strongest predictor of violence against all women, include older women, is childhood violence. The prevalence rate of partner and non-partner violence are much higher among women who experienced some form of violence during their childhood. Therefore, fighting elder abuse and violence against older women means address the whole life course and breaking the chain of continued violence some women experience all their life. Let's not forget that when speak about women, most research and existing evidence focus on women during their reproductive years. There is very little data on violence against women who are over 50. The research study done in Georgia is an important first step. It is a qualitative study, and it was done on a relatively small sample, but it points us to the right direction and show what the risks are and where we should be looking next. The project we have been part in Georgia also allowed us to do training for the Georgian Red Cross staff and volunteers. This is an important step in building capacity that will work towards effective prevention of violence and abuse. As you know, the Red Cross is present in every community. You could say that all doors are open for us, and we visit many people in their homes. Therefore, we believe that our volunteers and staff need to know how to recognize signs, indicating elder abuse when they see them and need to know how to react so that they keep themselves and the person targeted by abuse safe. In conclusion, we need more research and more emphasis on group at higher risk. We need better insights into the specific of this type of violence, such as neglect and financial violence, that present particular risk for older persons and older women. We need to collect evidence to influence changing in public policy that will protect them better. Globally speaking, it is very important to explore the intersectionality nature of elder abuse by seeing light of the different groups of older persons that are under multiple risk of violence. This will help us with intervention and prevention and making better use to sources, scarce resources at our disposal. I'm talking, for example, about older women living in rural area, older person living under the poverty line, and especially about the group that is the last visible when it comes to all, older person living with dementia. We need better implementation of existing regulation and new regulation based on evidence. We need work with both survivors and perpetrators after violence is reported. We need more services both to support older women who survive violence but also as prevention. We need support to informal and formal caregivers to reduce the risk of burning and community violence. We need also professional working with older people such as medical workers, social workers, as well as police to be trained to identify signs of abuse as they are most likely to witness them. We need to inform older person themselves how to recognize violence, how to report, and how system protect older person from violence. We must also work on the implementing legal protection of human rights of older person. New UN Convention of the Rights of Older Persons can be a global umbrella document that would bring us closer to our goal. At the end, I would like to thank you for your attention and to also thank the partners on the ACO project, particularly Georgian Red Cross, Austrian Red Cross, as well as the Austrian Ministry for Social Affairs, Healthcare and Consumer Protection for their support in this important project. I wish you a good day.